I want to start by just thanking all of our disaster service workers that have stepped up over the past 7 months in our COVID-19 response as public health officer and also as a resident of this community for protecting my family and our neighbors. Also, today is also a big day for us in terms of our COVID-19 response because we are taking an important step forward, probably the largest step forward that we have taken as a county since the beginning of the shelter in place that began in mid-March. So I'm just going to review kind of where we are right now with the numbers and then describe what the near tier status means for us and a little bit of the process of how we got there. Next slide, Alvaro, please. I have a slide presentation. Just go through the numbers. So as of today, we have a total of 4,233 cases. Thank you. We can move on to the next slide. This is the cumulative incidence in Marin County since the beginning of the pandemic. Next, please. 74,960 people tested so far in Marin County with a total of 4,233 cases. We've had 142 individuals hospitalized since the beginning, with now 80 total deaths. Next, please. This is our epidemic curve, and when we talk about flattening the curve, this is what we're talking about. It's the number of new cases per day, represented as a bar chart, and you can see the overall arc of our epidemic here. We saw a peak in mid-July and have seen, while there's a lot of variation day to day, you can see the overall arc there is towards significant improvement since that peak in July, which allows us to have the conversations we're having now about reopening. Next, please. I just wanted to call your attention to, back one, please. There we go, that circle. I just want to call your attention to that one particular spike on August 25th. That corresponded to a single outbreak in a single long-term care facility and a single day of testing where we tested every single individual at that facility. And that was an important day for us because it contributed to the redesignation, the surprise redesignation of Marin County as being headed towards Tier 2 last week. And whereas we were reassigned to Tier 1 based partly on that particular incidence of that one case or that one facility, and then other issues that I'll discuss shortly. Next, please. This is our hospitalization rates as a county. We have had the lowest 3-day hospitalization rate since in about 3 months. Our past 3 days together have been the lowest 3-day period since mid-June. Next, please. This is the demographics of our cases. The most important feature here is to look on the far left. You see our overall population in the breakdown by age. And what you see is about 21% of our population is above age 65. And that's represented in the green colors, but make up 96% of our total deaths. They also make up, actually, have a lower proportion among our cases than they are among our population, but much higher proportion of hospitalizations and deaths. And there's no important or no significant difference by gender. Next, please. This is the ongoing tally of our racial and ethnic makeup of COVID-19 cases relative to our population. And the most important feature here is that looking at Hispanic, Latino, people who identify as Hispanic, Latino, when they are tested, make up 70% of our cases, while they only make up 16% of our overall population, which has been one of the primary organizers of our response across the county to flatten the curve. Next, please. This is the new framework that the governor announced 3 weeks ago, the blueprint for the state of California. I've discussed this with you. I'll just briefly review. Every county of the 58 counties across the state have been categorized into one of 4 tiers. Those tiers are based primarily on, or exclusively at this point, based on 2 indicators. One is the number of new cases per 100,000 residents per day, averaged over a week period, and then the percent of positive tests among those who are tested. Any county that has either more than 7 cases per 100,000 or more than 8% positivity will be classified in Tier 1. That new cases column there is actually based on a raw number of new cases with an adjustment factor that takes into account testing rates. Marin County has high testing rates, so we are adjusted downward relative to the relative to the number of cases that we have, and that has been, I'm mentioning that specifically because it has been a source of questions from our community who may see a certain raw number of cases, but then see that we're actually allocated to a lower number with regards to the tier designation. And that's because we're testing a lot and we're given credit for testing in terms of the overall rate that was called an adjusted rate. Next, please. So here's our current status regarding reopening. On August 31st, we were designated among that majority of counties, 38 counties at that time, in Tier 1. That corresponded to what had been previously called the watch list or the monitoring list. We are among 6 counties that were destined, were flagged to be moving into Tier 2 last week on the 8th of September. There was, again, an 11th hour reversal of that determination. We had to stay in Tier 1 for an additional week. We are now today moving into Tier 2. And that redirection into Tier 2 was based on an adjudication process with the state, where we were able to advocate and clarify that there are special factors in Marin County that would allow us to move forward. So we are now in so with those Tier 1 openings, we're able to open hair salons, barber shops indoors, indoor shopping malls. Northgate was able to open at 25% capacity, and libraries also at 25% capacity, and those occurred on August 31st. Next, please. And now today, being classified as a Tier 2 county, we're able to move indoor restaurants at 25% capacity or 100 people, whichever is fewer. Again, bars where no meals are provided must remain closed. Indoor shopping centers can increase now to 50% capacity. We're able also to move personal services indoors, which includes nail salons, cosmetology, tattoos, etc. Museums can open at 25% capacity. Indoor places of worship can also open at 25% capacity or 100 people, whichever is fewer. Similarly, movie theaters, 25% capacity or 100, whichever is fewer. And then gyms and fitness centers can open indoors at 10% capacity. Previously, they had only been able to function outdoors. And then libraries are able to expand capacity to 50% in Tier 2. Next, please. For schools, after 2 weeks in Tier 2, schools can reopen to classroom-based learning following state and local guidance, and that includes TK through 12 as well as higher education. The earliest they could open for us then would be September 29th, which is 2 weeks after today. Currently, a waiver is required for any school to open because we are in that, previously we had been in Tier 1, and now we are in that first 2 week interval of Tier 2. Any school that wants to reopen to classroom-based learning needs to go through the established state process of applying to the local health officer for a waiver. And that's been limited to TK through 6 schools, 6th grade. 27 schools have applied for and received waivers. The total population of those schools is approximately 2,000 students, which make up about 5% of our total student population, TK through 12 in the county. In Tier 2, importantly, we will still require that each school that seeks to open, even after that 2 week interval has passed, to classroom-based learning needs to submit a school site-specific protection plan to public health for review prior to in-person learning. And our public health nurses will be reviewing those as they come in to ensure that they understand and can comply with what we see as the necessary elements of safer reopening. Next, please. So these are the outcomes of the adjudication process. As I mentioned, we had been among the 6 or so counties that were destined towards Tier 2 on the 8th. On the day before, on Monday the 7th, we were notified that there had been a reversal of that state's decision. We had received assurances as late as the previous day on Sunday the 6th that we were moving into Tier 2. We appealed that process. Had we not appealed that process, we would have been required to stay in Tier 1 for another 3 weeks. That appeal, a lot of work with the state, good work with the state, collaboration and communication over the period of the past week to understand the contextual factors for Marin. And these were the outcomes of that appeal process. We recognize, as I mentioned, that a large testing day at a single large long-term care facility experiencing an outbreak skewed our numbers upwards. We're a small enough county where an outbreak like that does make a difference in terms of our week rates across the county. There was also incomplete testing data available at the state level from Marin testing that had occurred, and we were able to bring that back in and have that correct our adjustment factor in a more favorable direction. And then there was a new state formula for adjusting case rates that had applied just before they recalculated our rates before that September 7th data run. That combination of factors was what led to the surprise reversal of the decision, and we were able to advocate for moving forward into Tier 2 based on that. Another important, I think, outcome of that process is we have stronger collaboration and dialogue with the state now. We are sharing data daily. They are sending us daily feeds of the data, so we're sure that we're looking at the exact same data, and we can offer course corrections along the way, so we're not surprised. We're having daily meetings. We met with them for an hour each day over the past week, and the communication has improved significantly. Next, please. Navigating the tier. So just, what does it mean for us? This tier process obviously is a new scheme for helping provide guardrails for every state every county across the state. It's a diverse state, 58 counties, lots of different factors. And the tier process is as simple as they can make it. It still remains a little bit complex, and we're learning, and I will try and help you understand exactly what the classification systems are and what the tier process is. So a CDPH will assess indicators, which is the adjusted case rate and testing positivity every week. That will occur on Tuesdays. A county has to remain in a tier for a minimum of 3 weeks before being able to advance to a less restrictive tier. And so right now we've been classified in Tier 2. The earliest we can move into Tier 3 would be 3 weeks from now. If either indicator moves into a more restrictive tier for 2 consecutive weekly assessments, we would move into that more restrictive tier. That means that if this week, if we have higher rates and the following week we have higher rates, within 2 weeks we could actually move back in. Could be compelled or forced to move back into Tier 1. Our numbers don't support that. We're doing better, and we wouldn't take the step if we weren't confident with that. But I just want to clarify that is a possibility by the rules of the tier framework. Once a county has maintained both indicators in the less restrictive tier for 2 weeks, and we've been in that current tier for at least 3 weeks, we're able to move into a less restrictive tier again. So we could move into that orange tier 3 weeks from now if we had at least 2 weeks of consecutive rates that correspond to that tier. Next, please. So here's our challenge. Our current adjusted case rate is 6. If you look at the widespread there, we have to be beneath 7 cases per 100,000 per week. Our percent positivity is 4. We need to be less than 8. So that's why we are now in that substantial category of the red tier. But we are closer to Tier 1 than we are to Tier 3, right? So we're more on the border between purple and red than we are between red and orange. Here's the challenge, is that reduced virus transmission leads for opportunities to reopen. The reason that we are able to reopen more wholly is because our case rates have decreased into those, to match those numbers that would allow us to open in Tier 2. The problem is that reopening itself can increase virus transmission. For example, as I mentioned, we can go indoor restaurants are now able to open, indoor malls, fitness centers. The reasons those things had been closed before is that we know that those are locations where transmission can occur. And so that remains true. So moving backwards is a possibility for us if the steps we take in reopening lead to more transmission. And I think we would all agree that that's an important safeguard to build into our response. So our goal is to make sure that while we recognize that the risk of transmission is increasing as we reopen, that we're all taking the personal measures to allow us to continue to move forward safely. So it is a matter of collective responsibility. Next, please. And to that end, we're moving into, as we have more freedom, as we reduce incidents and we have more sectors that are open, our own individual decision-making becomes more and more important. And so we're developing a set of talking points and infographics that are represented on our website that I'm just sharing with you here, which is helping us understand and navigate that continuum of risk that we face in our everyday lives. And this is, so on the left side, you have safer choices among common activities, and then riskier choices among common activities, including activities that are available to us. Just because it's open doesn't necessarily mean it's safe for everyone in every circumstance. For example, getting closer to strangers is riskier than physically distancing outside the home. Staying home if you feel ill is a safer choice than if you go out even though you're sick. Small gatherings are much safer than larger gatherings. These are the basic principles that we just need to continuously apply in our everyday lives. Next, please. Telecommuting when possible versus working in a crowded office. I think the sports that allow physical distancing versus participating in team sports has been a theme in our conversations with our schools. Speaking in a soft manner versus singing, shouting in social gatherings. It turns out if we're speaking loudly or singing or out, this has come up with some of our conversations about musicians who want to start performing outdoors. Unfortunately, that's an activity that actually increases the risk of transmission. So these are some of the principles that we want to make sure that everyone is aware of as we navigate choices available to us. The second one there, socializing with friends outdoors versus hanging out with friends indoors, I think is the single most important of these. One of the key principles of the entire concept here is that outdoors is safer than indoors. And if you look at what's newly available to us in Tier 2, it really is primarily that balance point between things are beginning to move indoors in Tier 2 that had previously only been available out of doors in Tier 1. Next, please. Just wanted to offer a brief update, and I'll finish with this on the Canal Outbreak Response Plan. We have been working, obviously the majority of the cases right now in Marin County are coming in the Latinx community. 70% of our cases, many of them are residents of the Canal area. We have had a concerted effort, intersectoral effort in the response plan, working with Health and Human Services, City of Center Falls, Kaiser, Canal Alliance, Marin Community Clinics, Marin Health, and that has been a robust and ongoing response. 7 different action teams meeting weekly. One of the overarching goals of that was to reduce the percent positivity among residents by 25% by the end of October. That rate now is 17%, which is down from 24% 1 month ago. So we are making progress. And I think that's probably the most single sort of best indicator of how well we're doing in terms of flattening the curve is the percent positivity among residents in that community. In order to really understand what's happening there, we need to be testing and intervening as early as possible. So another goal is to test 50% of Canal residents by the end of October on that same date. Currently about 30% residents have been tested, and we're doing about 300 tests per week among residents in the Canal. That's a very short snapshot of some of the primary goals. And I went, I think last time we spoke, I went through all of the different strategies that support those. Next, please. And that concludes my presentation. Thank you.
All right, excellent.